Senior drivers across Canada, listen up. Starting November 1st, S 2020-25, major changes are coming to your driving license renewal process. And if you're age 65 or older, these new rules could directly affect your ability to keep driving legally. What's happening isn't just a minor update. It's one of the biggest overhauls to senior driving requirements in over a decade. The government says these reforms will make roads safer for everyone, but many seniors are worried about what it actually means for them. Today, we're going to break down everything you need to know, what's changing, why it's happening, and how you can make sure your license stays valid without unnecessary stress. Welcome back to CCP and OAS Insider, the channel that keeps Canada's retirees and seniors informed about every update that matters, from pensions and OAS benefits to transportation and healthcare changes. If you're new here, hit that subscribe button and turn on notifications, because updates like this one can impact your independence, your insurance, and even your monthly budget. So what exactly is going on? Beginning November 1st est, every province and territory will start following a standardized framework for senior license renewal. This means that no matter whether you live in Ontario, British Columbia, Alberta, or Nova Scotia, the core requirements will be more consistent, fewer surprises, but also tighter checks. The main focus is health, vision, and cognitive ability. Officials say that while most senior drivers remain safe and responsible, medical conditions linked to aging can sometimes reduce reaction time or depth perception. Instead of removing privileges altogether, the goal is to identify and manage risk before it becomes dangerous. One of the biggest updates is the enhanced medical and vision test. In the past, many provinces only required a doctor's note or vision screening every 5 years after age 80. Now, the frequency and scope are increasing. Drivers over 65 will need to submit updated medical information every 2 years, including a brief cognitive evaluation once they turn 75. That may sound intimidating, but the test is simple. It measures memory, coordination, and judgment through quick exercises such as drawing a clock or recognizing patterns. It's not about tricking you. It's about confirming that your reflexes and awareness are still strong enough for today's fast-paced traffic. Alongside that, vision testing will become more detailed. Some provinces will now require depth perception and peripheral vision checks, which previously weren't part of the renewal. If you wear glasses or contacts, you'll need to bring your updated prescription to the exam. Failing to do so could delay your renewal. Officials say poor night vision and glare sensitivity are among the top causes of age-related collisions. So this extra step can save lives, including yours. Another key change is the shorter license validity period. Until now, many seniors enjoyed a 5-year renewal cycle. Starting November 1st est, most provinces will cut that period to just 2 years, once a driver turns 70. That might sound like a hassle, but it gives the system a chance to catch medical changes sooner and provide timely adjustments, such as daytime-only licenses or restricted zones for drivers facing certain health conditions. Think of it as an extra safety net rather than a punishment. Now, here's where things get even more modern. For the first time, digital renewal reminders will roll out nationwide. The new system will automatically send an email, text message, or even a recorded phone call when your renewal or medical report is due. This is great news for seniors who sometimes forget paper renewal notices that arrive by mail. But there's a catch. You must ensure your contact information is up to date with your provincial transportation department. If your email or phone number is missing or outdated, you won't receive that reminder. And if your license expires, you can't legally drive until it's reissued. That reactivation process can take 2 to 4 weeks, especially if new medical documentation is required. So take a few minutes today to check your information online or by visiting your local Service Canada or Service Ontario Centre. For seniors living in rural or northern areas, the government understands that travel to major testing centers can be difficult. That's why starting mid-November, new mobile assessment units will begin visiting smaller towns and communities. These mobile vans are equipped with eye testing machines and digital health forms so you can complete your renewal right in your hometown. This is part of a larger accessibility plan to make sure geography doesn't stop you from meeting the new requirements. Now, one of the questions we've been receiving from many viewers is, what happens if I fail the screening? The answer depends on the province, but generally it doesn't mean you'll immediately lose your license. You may be asked to attend a follow-up medical review, submit additional documentation from your doctor, or take a brief on-road driving evaluation with a certified instructor. If issues are identified, such as slower reflexes or reduced vision at night, you could be granted a restricted license. These restrictions might include daylight, only driving limited distance from home, or no highway driving. Remember, the goal is to keep you mobile and independent for as long as possible while also keeping roads safe for everyone. It's also worth mentioning that insurance companies are adjusting their policies in response to these changes. Seniors who voluntarily complete defensive driving courses or maintain clean medical and vision reports may qualify for premium discounts. On the other hand, failure to comply with new renewal standards could result in higher insurance rates or even non-renewal of your policy. So compliance isn't just about legality, it can also save you money. Let's talk about why these changes are happening now. Over the last decade, Canada has seen a steady increase in drivers aged 70 and above. With people living longer and staying active well into their 80s and 90s, more seniors are on the roads than ever before. Transportation officials say that while seniors are generally cautious drivers, the risk of serious injury and accidents rises sharply after 70 because of physical vulnerability. The new system aims to identify potential issues early, preventing tragic accidents while preserving your independence. To give you a clearer picture, let's look at an example. Imagine Margaret, a 77-year-old retiree from Saskatchewan who's been driving for over 50 years without a single ticket. Under the new rules, Margaret receives her renewal notice 2 months before her license expires. She schedules a visit to her family doctor, completes the short cognitive test, passes her vision exam, and submits everything online through the new digital portal. Within 5 business days, she receives confirmation that her license has been renewed for 2 more years. For Margaret, the process is smooth, just a little more structured than before. Now, let's take another example. Peter, a 79-year-old driver from Ontario, forgets to update his contact number. The reminder goes to his old phone and he misses his renewal deadline. When he finally visits the licensing office, he discovers his license has expired for 3 weeks. Because of that, he must undergo a full reevaluation before it can be reinstated, meaning no driving for at least a month. That's a stressful situation easily avoided by staying organized and informed. So, how can you prepare right now before the November 1st stroll out? Here's a simple checklist. First, check your license expiry date. If it's due before March 2026, consider booking your medical and vision appointments now. Don't wait for the last moment when testing centers will be busy. Second, contact your provincial licensing authority and verify that your address, phone, and email are correct. Third, talk to your doctor early if you have conditions such as diabetes, arthritis, or mild cognitive impairment. Keeping your medical records updated shows responsibility and makes renewal easier. And fourth, practice safe driving habits. Always wear your seatbelt. Avoid night driving if vision is limited, and refresh your defensive driving knowledge through free online resources. Another new aspect under discussion is the Senior Driver Support Program, expected to begin trial runs in 2026. This initiative will provide free transportation counseling, helping seniors decide when to continue driving and when it might be safer to switch to community transit or car sharing options. It's not mandatory yet, but if successful, it could become part of the renewal process within a few years. Now, let's address a common myth. Many people believe that these new policies are about forcing seniors off the road. That's not true. Government data shows that more than 85% of drivers over 70 pass their renewal tests without issues. The program is about ensuring safety, not taking away independence. In fact, in several pilot regions where enhanced testing was introduced early, accident rates among seniors dropped by 14% within 2 years, proof that these steps actually work. There's also a new education component. When you renew, you'll receive a brochure or digital guide summarizing safe driving tips for older adults. Things like adjusting mirrors to minimize blind spots, keeping longer following distances, and managing fatigue. These small adjustments can dramatically reduce risk, especially on busy highways or in urban traffic. Let's shift focus for a moment to how provinces differ slightly. In Ontario, the group education session for drivers 80 and older will remain, but will now include a digital knowledge test, an optional simulator practice. British Columbia will introduce mandatory vision testing at every renewal from age 70, not just 80. Alberta's medical report requirements will begin earlier at 65 instead of 70, and Quebec will implement online self-assessments where seniors can check their reaction time before attending their in-person exam. So depending on where you live, the details vary, but the overall direction is the same consistent proactive safety checks for all senior drivers. For families of senior drivers, these changes bring peace of mind. Many adult children worry about their parents' ability to drive safely but don't want to take their independence. The new system relieves that pressure by making professional assessments routine rather than emotional conversations at home. As November approaches, expect to see public service ads on television, radio, and social media, reminding seniors to renew early. Local clinics are being trained to handle the additional medical forms, and some pharmacies may even offer quick vision screenings that meet the new standards. The goal is convenience and safety combined. Now, let's talk about costs. The base renewal fee will stay about the same, typically $75 to $90 depending on province. But the new medical and vision exams may involve extra costs if not covered by insurance or public health. Some community centers are lobbying for rebates or coverage under senior benefit programs. Keep receipts for any testing you pay for future tax credits for senior mobility expenses are being discussed at the federal level. If you're watching this and thinking, I've been driving safely for decades, I shouldn't have to prove myself. Remember, this isn't a question of skill or pride. It's about evolving road environments. Traffic is faster, vehicles are more powerful, and distractions are everywhere. Even a momentary delay in reaction can make a difference. These assessments ensure you're equipped to handle modern conditions confidently. And here's a positive takeaway. By embracing these changes, seniors set an example of responsibility for younger drivers. You're showing that safety matters at every age. Many provinces plan to use the same model later for commercial and professional drivers, meaning this isn't just about seniors, it's a nationwide safety standard upgrade. Let's recap the essentials before we close. Starting November 1st, 2025, enhanced medical and vision testing becomes mandatory at renewal for drivers 65 and older. Cognitive screening begins at 75 and above. License validity shortens to 2 years in most provinces. Digital reminders replace paper mail notices. Mobile testing units assist rural residents. And failing an initial test doesn't end your driving. It leads to reevaluation or possible restricted privileges. So take action now. Book your appointments, verify your details, and spread the word to friends and family. Don't let paperwork or a missed message cause unnecessary frustration. Staying proactive keeps you on the road and in control. If this update helped you understand what's coming, please give this video a thumbs up and share it widely. There are thousands of seniors who still haven't heard about the November 1st rollout, and your share could make a real difference for them. Also, comment below. Are you ready for the new renewal rules? Have you already completed your medical or vision exam? I'd love to hear your experiences, and your stories might help others prepare. Thank you for tuning in to CCP and OAS. Insider, your reliable hub for pension, benefit, and policy updates that matter most to Canadian seniors. We'll continue tracking every provincial update on this story and bring you follow ups as new information becomes available. Stay informed, stay prepared, and above all, stay safe on the road. Until next time, this is CCP and OAS Insider signing off. Keep driving smart, stay confident, and remember, safety and independence go hand in hand.